أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. Dear students of third year or final year, or those who are appearing in postgraduate examination, I want to discuss something about the jaundice, mainly caused by the microbial agents, that is viral type of problems. It's acute in nature, that is acute viral hepatitis. But before going forth with, the slogan is, this tutorial is split into 3 sessions, as it is very important common topic, it's a prolonged topic. The students will face in examination this type of a problem. They will face in the examination and then in the future also. That is, they have to face the patients. Patients are your examiners. Patients are your everything. Because the patient which will be true examiner for you now, after you graduated, and they are end beneficiaries. They decide whether you have correctly done your training in as undergraduate or postgraduate student. Now they give feedback, because if you can confidently handle them properly, you will be successful. Otherwise, if there is slight tremor in your hands and you are not confident, then they will not follow up, and they will not come to you again. To show something about the hepatitis session 1, I am Professor Syed Riyadar, and representing as a visiting professor of medicine, Jinnah Sindh Medical University, Karachi, Pakistan. Now, conditions that cause hepatitis in human is of microbiological agents, chemical agents, and others, like a group of the hepatitis viruses, hepatotropic viruses, that is hepatitis A virus, B virus, C virus, D virus, E virus, and TT virus also. Now, some other viruses are also described. Other than specific hepatotropic type of viruses, there are other viruses which will cause the multi-system involvement, like Epstein-Barr virus, HIV, Lassa fever virus, yellow fever virus, adenovirus, herpes simplex virus, human herpes virus, Ebola virus, and dengue virus also coming in this. Non-virus infectious agents like bacteria, pneumococcal pneumonia, leptospirosis, and syphilis, and Coxiella burnetii, which is rickettsia also, toxoplasmosis, which is a parasite which can involve the liver, also involving the echinococcus granulosis, can cause it, and some of the nematodes can involve it. It is possible. Non-infectious causes are alcohol, medication like Dilantin, phenytoin, that is isoniazide, ritonavir, and chlorpromazine, rifampicin, NSCCL, halogen, etc. There are many other drugs which can cause. Chemical agent, poisons can affect the livers, and the patient will come into acute hepatitis. The clinical terminology is hepatitis. Acute means acute, chronic means chronic. Hepatitis is inflammation of the liver, the presence of the inflammatory cells in the organ tissue. Neutrophils are invading the liver, as there is hepatocytes which are involved, the anticellular spaces are involved. Acute viral hepatitis symptoms last less than 6 months, around 6 months, less than 6 months. It is called the acute viral hepatitis. Chronic hepatitis is more than 6 months. Acute hepatic failure or acute fulminant hepatitis. Acute hepatic failure, it is the massive hepatic necrosis with impaired consciousness within 8 weeks of onset of illness. It is possible with any type of viral infection, whether it is A to E. Now, cirrhosis is another condition which causing the replacement of the liver tissue, which is followed by the inflammation leading to the chronic inflammation leading to the fibrosis, and it will form scar tissue. It causes the portal hypertension. Fibrosis, hepatic fibrosis, is the terminology in which only fibrosis is seen. It may be followed by the acute hepatitis, it will not be followed by the acute hepatitis. Fulminant hepatitis is severe impairment of the hepatic functions of the severe necrosis of the hepatocytes in the absence of the pre-existing liver disease. Previously there was nothing. It is definitely a severe impairment leading to the hepatic encephalopathy in very quick time. Now, hepatitis liver attacking viruses that is called the hepatotropic viruses. They are hepatitis A, the fecal-oral contaminated food vaccine available. All viruses are RNA viruses except hepatitis B, which is not the RNA virus, it is a DNA virus. Hepatitis B, blood, semen, vertical, mother-child vaccine will be the parental. It should be parental route of administration. The common problem in Pakistan, and hepatitis C is the blood IV drug use, transfusion, organ donation, unsterile injecting equipment, sexual intercourse through any route. It may be sodomy. And hepatitis D, which is incomplete virus actually it is, and it survives only in the cells co-infected with the hepatitis B. It needs hepatitis B to go for the acute inflammation. Hepatitis E is again the fecal route, contaminated food or water. It is not parental, non-parental route of administration. And another virus which is a new entity which is described by the Australian scientists is TT virus, transfusion virus, induced virus, or TT virus. Now, characteristics of hepatitis virus, I have said that they are routes of administration, transmission, and it is all viruses are RNA viruses except the hepatitis B virus, which is DNA virus. All viruses are the route of administration fecal except hepatitis B and hepatitis C and hepatitis D. So remember these things. They have a high mortality with the hepatitis D virus, which is accompanied with hepatitis B virus. Otherwise, the mortality in case of the hepatitis A virus is very low, outcome is very good. It will not cause chronic inflammation. Hepatitis E virus is low moderate, although it will not cause the chronic inflammation in most of the cases, but there are certain serotypes which can cause problems of, you can say, the subacute infection is going on, and it may end up as a chronic hepatitis very, very quickly, leading to the destruction of the liver. The hepatitis E virus is a very important virus nowadays. Acute viral hepatitis, all virus, whether A, whether E, whatever it is. The patient comes to you with a fever, with the fatigue, with the loss of appetite, with the nausea, vomiting, abdominal pain, jaundice. It may be the tenderness in the right hypochondrium, and there will be clear stool is possible if it's cholestasis and joint pain. Now this is the research of the all viruses. Mostly you see 95% is the males, and then jaundice maybe possibly if it is the total bilirubin is more than 3 milligram. Anorexia, you will find 90% nausea, 80%. This is traced to the cigarettes, this is traced to the tobacco, right upper quadrant pain 60%, itching 10%, and fever, because it is a viremia, it can cause rash, it can cause reactive arthritis. So there will be incubation period, in which case only you see there is a patient may be anorectic and maybe slightly feverish. Pre-ectatic phase you find more extension of these symptoms. In ectatic phase, definitely the patient will come to you because he noticed now the yellow discoloration, and there will be a convalescent period with different type of viruses. Viral hepatitis is the leading cause of the liver cancer and most common reason for the liver transplantation. There are approximately 1 million chronic carriers of hepatitis B and 1.7 million chronic carriers of hepatitis C in the province of the Sindh. The Delta virus association is seen with the B. In the study, it is reveals that it is co-infected with the B in 28.3% in Karachi and 60.7% in other areas of the Sindh. So the management will be difficult. If the B is associated with the D. Now each year is estimated about 21,000 persons become infected with hepatitis A and 35,000 with hepatitis B and 17,000 with the C, and you can say about 3,000 to 5,000 people associated with E. I will talk hepatitis A only today in the session. Hepatitis A virus is a coronavirus and it is RNA virus. The corona group of virus is a big group of viruses. It has the other viruses as well, like rhinoviruses and the other viruses you see, Coxsackie and enteric viruses. It is also one of the part of it, the coronavirus group. Its structure is shown to you, and the capsid and the antigenes which are seen here. Epidemiology is vast. Remember that only the young people are involved with hepatitis A in 90 to 95% of cases. If a person comes to you after the age of 30 and he is presented with acute hepatitis or jaundice, chances of hepatitis A is very lower. Moving towards the 40 years, very least. Now after 60 years, very, very uncommon. So it is a virus which has very, most of the countries where the hygienic problem is going on and people are fond of eating outside, and there is they don't know the hand washing techniques. So they develop this, and it is infective agent, so it will transmit in the house with other people. In the prevalence of antibody to hepatitis virus is seen in these countries. Immunity developed in these countries, which is seen, and we are the countries also where is high epidemiology. That is Indo-Pakistan, Southeast Asia, and the mid-African countries and South African countries. But it is worldwide it is. Incubation period is 15 to 20, about 50 days ranges. It is 28 days approximately. If somebody has taken some food outside, acute poisoning, food poisoning occurs and went off, and then after 28 days he developed nausea, vomiting, and the yellow discoloration, etc. It is possible after 28 days. A virus replicates in the liver cells and shed in high concentration in feces before 2 weeks to 1 week after the onset of the illness. So the person who is involved with this should be very careful that the other people of the house will be affected if the hygiene is not properly followed. Infection of the hepatitis A virus is a cell-limited disease. Okay, no problem, because it will not cause any chronic infection, chronic liver diseases, etc. But remember, this virus can cause acute fulminant hepatitis. Any virus can cause acute fulminant hepatitis, and I have seen the cases, the patient go into the hepatic encephalopathy. Humans are the only natural host. So they spread this infection. A features, same one I have told you previously, that any virus can cause fever to nausea, jaundice, and the total duration of the fever of the infection is around 25 to 30 days. After you infected, you will become fine after 1 month. It means that acute illness in the children, they are the target, and teenagers, they become lethargic and feverish, and they do not want to eat, anorectic, and symptoms usually last less than 2 months. It may be 1 month hardly. And only the 15% of symptomatic person have prolonged or relapsing disease. It may be possible that it's called post-hepatitis syndrome, up to 6 months. You find that the patient is not, regained his activity as previously. And only in about 10 to 15% of cases, it is called post-hepatitis A syndrome. Lethargy and depression occur in these cases, and the children are affected, and they cannot perform properly at the school because of the depression, because of the fatigue. These types of symptoms occurs in only 10 to 15% of the patient. Diagnosis can be done with the anti-IgM, and 5 to 10 days before symptom you can detect it, and they disappear by 6 months. But IgG can be convalescent. It is lifelong, confers protection. For example, somebody is pregnant, you can do this screening. The treatment of this virus is only supportive. Number one, reassure the patient or family, rest in the bed, take proper food, do not give any drugs, do not give the supplementary medications, please. All these, the spiritual type of the event can be practiced. It is possible, like फूकना, झाड़ना, तिलावत कुरान और उसका दम करना. Yes, do it. Diagnosis, we said that is the infection, typical serological course. Fecal shedding is, you see, fecal HIV virus is seen in up to 2 months, it is lower down after 2.5 months. At the same time, you find the ALT. The symptom ALT will be higher and higher and higher during these days, the first 2 weeks, and then it will be gradually, it will become lower and lower and lower, and it will come to the normal in about 2 months or 3 months. And in the same way, the total IgM anti-HIV, the same fate. That is concerning, that it is a parabola, going up and up and then going down in 6 months. However, the anti-HIV IgG can be present for the whole life. Only IgM anti-HIV can be present, and it will be again in the same thing. That it will cause increment and then stability, peak, and then going down and down in about 4 to 5 months and taper off. Transmissions, fecal-oral contamination, I have said, the water, sexual, finger, and fecal route, I have said that about it. Flies, FFFF. Now these are the transmission. The risk groups are the international travelers and child carers and those who are associated with, it may be caused by the sexual. It is one of the causes of the illness which can be availed, which can be achieved by the uh, illegal sexual pleasures, injection drug users, definitely, and period of communicability within first 2 weeks, highly infectious disease. Endemic areas are seen mostly in the Middle East and Asia. I already said South Africa and America and Central and South America and Western Pacific. Reservoir are humans only, no animals. Age group are seen that is mostly it is the teenagers, and then teenagers are involved. And lower down you see that up to 8 to 5 and they are involving, but in cases of 2004 you see that it is peak. It is 20, 21, 22 years of age. Hepatitis epidemiology by the United States is done, and they said that it is growing actually in those countries where the hygiene practices are not done properly. Vaccines are available, inactivated whole virus vaccine, pediatric and adult formulations are available. You can inject those in those areas which are where high endemicity is there for the person 12 months of age to 18 years. You can inject in the pregnant women as well if they are IgM positive. Adult formulation approved for the person 19 years and older. It may be possible that you are a traveler and you are under 30 years of age, that this vaccine can be injected. The immunology is concerned, and more are the people IgG positive whole life, and after they gain immunity, seropositive after 1 dose, 100% perfect seropositive after 2 doses. So mostly they are IgG which are formed, acquired immunity. Children under more than 12 months and adolescents, more than 97% after 1 dose, highly they are effective vaccine in the young people, and 100% after giving first dose, and then after 1 month you give the second dose, booster dose. The recommendation for the vaccination that now in the program which is launched by the UNICEF for what is called the EPI, the extended program of vaccination and immunization, that this vaccine should be included in those areas which are under the charter of the endemic declared by the WHO. International travels, before the age of 30 years, they should be injected. Or those who are traveling in the area where there is high endemicity or epidemicity, so any age group can be involved, so the vaccination should be done. And those people who are immunocompromised, those people who are taking steroids should be given this vaccine. And those people who have declared previously the CLD, chronic liver disease, and the young people who have got the occupational risks, etc. Post-exposure prophylaxis, that is, if you are exposed to it from 12 months to 40 years of age, only the single antigen hepatitis vaccine should be administered as soon as possible after exposure. Older than 40 years, first you will give the passive immunization with the immunoglobulin, which is available in market. You give this immunoglobulin that is specifically for the hepatitis A virus, and then vaccination can be used if IgG cannot be obtained. Okay, if it is not obtained, levels not achieved, then vaccination after 1 month should be given along with it. Prevention is better than cure, yes. Good sanitation, good personal hygiene, hand washing properly done. Do not eat the unhygienic food outside. So these are the hygienic type of the advices which we will give to the person. So this is the end of session 1, and we will inshallah go through with the session 2 very soon, inshallah ta'ala. So see you inshallah. afterwards, and I hope that you have understood which I have just elaborated in front of you. Please remember it. Try to remember it. وما علينا إلا البلاغ. السلام عليكم.